and we have the tools. We're fairly successful, I think, in developing programs where we can clean a herd and remove a disease. But some of that is fairly expensive and requires a big commitment. So the decision is whether you're going to attempt it or not, and if you do, how to go about doing it. And I think most of our disease eradication efforts involve controlling the flow of the pigs, creating a herd immunity in some way, spreading the disease around so that the sows are producing immunity to the piglets, and then breaking up the flow of pigs so that those newly born pigs don't encounter diseased pigs later on.
Well, welcome everybody to the Swine Canada podcast. I am Dan Columbus and I'll be your host for today's episode. With me today, I have Dr. Bob Friendship, who is a University Professor Emeritus at the Department of Population Medicine in the Ontario Veterinary College at the University of Guelph. Welcome to the show, Bob.
Thank you, Dan.
I'm sure people are probably well aware of you with your career in the swine industry, but just in case, I will just ask to start by introducing yourself and kind of giving us your story.
Okay. I graduated from the Ontario Veterinary School in 1977. I returned in 79 to take on a faculty role, and since 1979, I was involved in teaching vet students about pigs and pig health issues, taking them out onto swine farms, and I started doing research on swine issues, taking on graduate students. But so I've done that for about 45 years, and I've the swine industry, as you can imagine, from 1979 until now has changed dramatically. And some of my lecture notes, absolutely wrong. We've learned a lot. I've certainly learned a lot. And it's been a good way to keep up with the swine industry is having to teach students every year and be involved. And I kept in touch with the industry, getting out onto farms, and and I've done a fair bit of research. I've published about 250 papers in refereed journals and that sort of thing. But I guess what I'm most proud about is attracting a few young vet students into the swine industry. And so there are some vets kind of all over the world that I've had a little bit of help in mentoring them. So that's been good.
Yeah, definitely a benefit, is to have that influence and to see them go even worldwide and do that. So, so I guess this is a perfect person to have on, considering the time that you spent in the industry and specifically with swine health, to talk about swine health management. So that will be our topic for today. So I guess we'll just get started on that. And so what in general should be included in a swine health management program?
Yeah. And I've guessed, because of my years, tried to teach this to veterinary students that are trained in a very different model. You take a dog to a vet, and it's a very individual animal approach. And everybody's rather familiar with it. It's the same as what the human medical approach is, and involving CAT scans and all kinds of diagnostic work on an individual. And so I have to explain to the students that it's a herd approach in swine, and the essence of this. What a herd health management program that a swine veterinarian might offer their clients, I break it down into about 4 or 5 categories and then go into much more depth in those categories. But I start, my number one category is you need to keep the disease out of the herd. And that's part of your job, is to make sure that disease doesn't get in. So this whole idea of biosecurity, back in 1979, that wasn't a big deal. The swine herds were small, and most of the diseases they were going to get, they already had. Biosecurity wasn't such a big problem. But today, larger herds, and most of those herds are fairly high health. They don't have the important diseases. We've been able to figure out how to create breeding herds that are selling breeding stock that are free of the big diseases, and so you can start up a herd that has pretty high health status. And part of a health management program would be to make sure that it stays free of that disease. So things like gilt isolation facilities, washing trucks, and putting in an entrance so that people at least take off their boots and put on farm boots, but maybe more than that. But a Danish entrance system where boots and then coveralls specific to the farm. But there's, again, that will be a whole lecture in my courses on biosecurity. But I see that as one of the big components. And then the follow-up one is that what happens if disease gets in? If it's an economically important disease that you will have trouble living with, I think a big important message is to eradicate that disease, push it out, and we have the tools. We're fairly successful, I think, in developing programs where we can clean a herd and remove a disease. But some of that is fairly expensive and requires a big commitment. So the decision is whether you're going to attempt it or not, and if you do, how to go about doing it. And I think most of our disease eradication efforts involve controlling the flow of the pigs, creating a herd immunity in some way, spreading the disease around so that the sows are producing immunity to the piglets, and then breaking up the flow of pigs so that those newly born pigs don't encounter diseased pigs later on. And so a lot of strategy involved, and quite a commitment. And it also involves a lot of testing and to ensure that you finally got rid of it before you relax and go back to normal. So eradicating disease is the second point. And then we get into living with disease, and we do that a lot. There's diseases that we can't eliminate, or we just it's not economically feasible to go through the efforts of getting rid of some of these diseases. And so living with disease, and if it's an infectious organism that's driving this disease problem, I think our approach is the same with almost all of them, and that is we maximize the immunity and we minimize the challenge. And so, for an example, E. coli diarrhea in suckling piglets, we can vaccinate the sow, and she produces immunity in the milk to protect the piglets. But if the farrowing crates aren't cleaned and there's a big challenge from the environment, the vaccine probably is not going to work very well. So it's a combination of all in, all out management of a farrowing room with washing and maximizing immunity by vaccination or exposure of the sow to the organism, but somehow getting those in balance. And on a lot of our farms, we have the diseases that nobody pays much attention to. They hardly ever flare up because we have that sweet spot, that balance. We've got a lot more vaccines than we used to, and they play a big role in this. And we're much better at this all-in-all management and designing facilities that are easier to reduce the challenge. And whether people think about it or not, that's what they're doing, is controlling these endemic diseases with maximizing the immunity and minimizing the challenge all the time. And then I think the next point is that there are diseases on pig farms that may not even have an infectious component, but if they do, it's not the main thing. We've got diseases that are caused by multiple factors, and they interact, and that's hard to get your head around how they flare up, and you have to look at all the different factors and which ones can you get under control or change and bring this disease down. I think examples that aren't infectious that are big problems, like gastric ulcers, tail biting, rectal prolapses, osteochondrosis, this lameness in sows, the young gilts that go lame. They have multiple factors and may or may not have any infectious component at all. And they are a big part of our controlling health problems on farms. So the final point I try to get across to the students that are thinking of going into a swine health management practice, and what that job entails is monitoring and surveillance. I think we do that more and more, and we have better and better tools to do it. So it involves certainly walking through the barns and seeing pigs and doing the traditional spotting the health issues, fresh set of eyes that sees the diarrhea that the producer isn't noticing, or the coughing that seems to be just getting hot more and more. But also along this surveillance, there's all the production records, the easier to with automatic, the electronic records that are being kept for feeding and water consumption and weighing pigs, and the traditional things like farrowing rates and whatnot, and you spot problems when the production records show a problem, and then there's all the diagnostic testing. I mentioned gilt isolation barns, and they'd be pointless without being able to go in and get samples and test for PRRS or whatever diseases that you're very concerned about that you don't want to bring into your barn. And so surveillance plus handling the endemic diseases and keeping disease out of the barn. All of that is a swine health management program, and it doesn't look anything like bringing your pet to the clinic. Yeah. So it's sometimes a hard sell for vet students that don't know anything about pig farms. But.
Yeah. No, a lot of different components to that. Obviously, all very important to maintaining this. Maybe we'll delve a little bit deeper into each of these. We'll start. So you mentioned the eradication of disease. Obviously that's not going to be easy. You mentioned cost of as one of the factors. I guess, what are some of the main problems that would be encountered when you are trying to eliminate these diseases? And we can even use PRRS as an example.
Yeah, and PRRS is a great example. It's probably the most common reason that we go about trying to get rid of a disease because it can be so expensive. And as everybody knows, PRRS has the big outbreak, and you have abortions and pre-weaning mortality and everything, and then it will settle down, and there will be a period where it looks not too bad, and because there's fairly widespread immunity, and if you're trying to get rid of PRRS, the danger is these inapparent carriers. I think we learned that with COVID, that there's people walking around spreading COVID that didn't feel sick. And there's pigs in a pig barn that are walking around. PRRS is an awful disease that the pigs could carry it. They'd be viremic. It would be in the bloodstream. They'd have antibodies, and they'd still be carrying this virus for weeks and weeks. So a long period where they're potentially infective. And one thing that we've learned about PRRS is that it can hang out on a farm at a very low prevalence. So most of our testing, we assume 10% prevalence at least, and we sample a small group of pigs that based on our sample size and our science, we think we will be able to find it. If it's still around and we test 20 or 30 pigs, we'll get it because if it's there at over 10% mortality or prevalence, we'll find it. And on farms where it's down to 2% prevalence, there's a good chance we won't find it. And I think there's lots of times we've been fooled that we think it's gone. There's no clinical signs, and we've tested a few pigs. They're negative, but it's still around. We just didn't test the right ones. And so inapparent carriers, and I would guess I maybe make a point here that one thing that I think is very obvious is that the group that you really have to concentrate on, the scary part, is the nursery pigs. I had a colleague that called the nursery the kindergarten or daycare, where if you have young kids going to daycare or junior kindergarten, they're always bringing home disease. It just cycles in there. And that's what happens in a pig barn. These piglets, they've gotten passive immunity from the sow. They don't show any signs. They go into the nursery, and that immunity gradually goes away, and they are essentially negative. They have no immunity, and they go along for a while, and then they encounter some virus, and they become positive and start shedding. And so the next group that comes in, because that one pig became infected, it's shed virus and it spreads to the next group. And you may not see any signs of disease, but this is going on in the nursery. Nurseries are the problem, the same as kindergarten is the problem for the human population. And so successful PRRS elimination often comes down to depopulating a nursery, just because there isn't a good way to keep them away from the ongoing disease, and so a month without nursery pigs around on the farm really helps settle that. And eradication. I think handling the nursery is always the biggest problem, I think, in eradicating those diseases.
One of the other things you mentioned was that many of these infectious disease agents are present on every farm, and you live with them, right? But that they only really cause serious problems on a small number of farms. So why would that be the case?
Yeah, and I think there's two main reasons for that. One is that on most farms there's this nice balance between immunity and challenge. That there's lots of immunity, the challenge isn't very high, the disease is around, but it doesn't do anything. And on another farm, either one or those is out of whack, so the lost the balance. There's too much challenge for the level of immunity, or well, yeah, that's what's happened, and so that's one reason. The other one is this idea that diseases have multiple factors. And I think there's lots of examples of pig diseases that they're there on every farm, but on this particular farm, there's also some contributing factors that make it worse. So maybe the easy example, the GI, the diseases causing diarrhea, maybe on farms that aren't as good at washing and cleaning and all in, all out and everything, may have more problems, even though, it's the same organisms on other farms, but they just haven't got a handle on sanitation. And with respiratory disease, the obvious one might be that the ventilation, the maybe the crowding or mixing of pigs is worse on one farm than another. But some of these diseases, the factors are we don't know all of the things that contribute, and it gets complicated. There's certainly nutrition and genetics and environment and lots of things. And I would just say that this is probably a good time to just comment that swine disease is complicated. It is. There's a lot of different factors, and every pig barn is just a little bit different. And you're never, there's not an easy formula to follow. It's a bit detective work, I think, sometimes. Yeah.
I don't think you could have had a 45-year career in something that was easy, right? It's the complication is what leads to that. So in your management plan, the last one you mentioned was surveillance as one of the key components to that herd health program, right? So how has this aspect evolved over the decades? You talk about back from 1979, to now.
So there's one slide that I use with the students to show the record-keeping system in 1979. It's a cigarette package with numbers written on the back, because then everybody smoked, and that's what they had available, and they'd have a pen or pencil, and they'd write down, oh, there's a pig dead in such and such a pen, or this sow was bred to this boar. And the record-keeping system was done by hand. 1979, there were not personal computers. There was no PigChamp or computerized records, and so there was that. And then when it came to disease diagnostic tests, really there wasn't any PCRs, and there wasn't much of anything. So it really was pretty primitive, pretty hard to keep track of just the endemic diseases that are there. I think if we had a big outbreak, some dead pigs, some tissue, the pathologist could work through and probably come up with a fairly good diagnosis. But this day-to-day monitoring of a lot of different organisms, getting quick feedback from a PCR test for PRRS, can come back the next day, and that's what you need. You're going to bring this animal into your barn, and is it positive or not? And all of the different testing, so much more available and better and more accurate. The records, there's just far more available, and the challenge will be how to use it on the day-to-day workings, because there's going to be data coming in from the feeding system and the water and a lot of different areas are going to be giving you information, and you need a way of handling that, and hopefully AI will solve it, I guess. But
I guess we'll see with AI. That one's an interesting one to see what impact it's going to have, I think.
Yeah.
So, keeping all of this in mind, I guess, what type of health problems do you think are the hardest for swine practitioners to solve?
Yeah, and I think one of the ones that is really hard is when the disease is, or the health problem is caused by 2 or 3 different organisms, and they're working together and maybe making it much worse than any one of them alone. And I think that happens just all the time. We've identified, we call it respiratory disease complex, which is that respiratory disease in a lot of grower finisher barns where the pigs are coughing and you get a diagnosis. You think it's enzootic pneumonia, but there's also influenza. And there's also PRRS, and maybe circovirus is doing something, and all of this is happening. And there's secondary bacteria because these viral diseases are suppressing immunity, and sorting that out and knowing which to tackle, and probably you only need to really get a handle on 1 or 2 of those and everything settles down. But it's complicated, and you could say the same with the pigs out in the grower finisher barn that have diarrhea. They probably have more than one thing going on, and so that mixture that we very often deal with, that individually aren't as important, but that combination, that soup, is hard. And another aspect of swine health management that I think veterinarians have a lot of challenge with is sort of solving what's going on, coming up with an idea of eradicating or improving it, and then getting a buy-in from the producer, because compliance, and it's not unique to swine health management. I think most medical doctors would say the same thing. It's in other fields of veterinary medicine, it's sometimes the steps you'd have to take to get the long-term benefit from solving this disease problem, it's too risky or too much work, or maybe it's just easier to put more antibiotics in the feed, cover it up somehow, live with it. And I think that getting compliance for a problem that isn't killing the pigs, it's just slowing down growth rate, making feed efficiency a little bit poor, to get involved in sort of cost-benefit analysis and make a convincing argument as to, why you maybe need to change the whole ventilation system or something that's going to be costly or not an easy pill to take, I guess. That's quite a challenge, and that's not quite the answer to your question, but I think it's worth bringing up here. Yeah.
No, I think that answers the question pretty well. That's it does seem like that would be one of the biggest challenges. So I think, no, very good. So we're getting to the end of our time. So I guess I'll just ask for one final take-home message for our listeners.
Yeah. I'd go back to the fact that this is all complicated, that it looks simple, and I think if you break it down just to the fact that you want to keep the disease out. When it gets in, it's much harder to deal with, and if you can eradicate diseases feasibly, you should really consider that, because living with them long term, even if the vaccine is working pretty well, even if the antibiotics are covering the problems pretty well, that all costs money. And these things, I think you need the records and know what these things are costing, and don't jump into an eradication program or anything without really thinking out what it's going to cost. But I think generally in the long run, eliminating a disease and getting 5 or 6 years of freedom from that is going to be better than 5 or 6 years of vaccines and antibiotics and other issues, the chronic losses. So maybe that's the take home is keep good records and think it through, but try to, I think, eliminate disease if it gets in, keep it out if you can all do that.
Yeah, makes sense. Okay, so it's time for our final 3 questions that we ask every guest.
It's time for our famous 3. Swine Veterinary Partners offers a full range of animal health and production services to Canadian pork producers. We approach health management through personalized solution with concern for profitability while taking into account performance and the well-being of your animals.
So our first question is, what is your favorite swine-related resource?
Yeah, it has always been the diseases of swine, the Bible of swine veterinary medicine. And I'm finding that with a computer and the resources that the university has, as a professor emeritus, I still have access to the library and all the journals, and it's getting much easier just to sit here and type in and pull down some good review articles and things. So that's starting to replace diseases of swine, but that has been the go-to for me for 45 years. Yeah.
I kind of saw that one coming. You would have surprised me if you had said something else. So our next question then is, what is your favorite book or resource outside of pigs?
My favorite book. And I'm going to say that right now, 1984, George Orwell. I just had watching the American election, and what a wonderful book 1984 was, and so predictive of various authoritarian regimes all over the world, and I think everybody needs to read that and to have a feel for what's going on. But currently, I'm reading Malcolm Gladwell's new book, which is a sequel, really, to his first book, The Tipping Point. And in the swine world, that's as close to explaining what goes on in a pig farm without getting into a lot of I don't think he ever mentions anything about pigs, but he does talk about epidemiology and how everybody thinks linear and yet diseases and big problems occur in an exponential way, so that a little change today, and you see this huge outbreak because you decided to change the feed or do something, and boom, it was just the tipping point for one of these problems that have multiple factors, and you added a new factor and made the difference. And so I like Malcolm Gladwell's writing. He's grew up locally here, not far from Guelph, and he's done well. He's New York Times best-selling lists for a lot of his books, and that's very insightful, I think.
His new book's on my list. I just need to get around to it. So, because I've enjoyed his other ones as well. So our last question is, what do you think is a characteristic that successful leaders or mentors all seem to share?
Yeah, and that's a it's not an easy one, but I look at the people that that mentored me and everything, and what they somehow accomplished was they made me think that my opinions mattered, that they listened and didn't dismiss what I was saying. Made me think that, I can contribute. My ideas matter, and that's not easy because these people knew a hell of a lot more than I did, and sometimes what I was suggesting was just rubbish, but they didn't dismiss it. They were encouraging, and so I think all good mentors and leaders encourage the people around them to contribute and feel part of the team, and I'll go with that.
Definitely agree. Well, Bob, it's been great having you on. I really appreciate it because it's been a while since we've talked, and so it's good to even catch up a little bit. So I'll just end by thanking you for coming on the show and sharing your knowledge on, like you said, a very complex subject.
Thank you, Dan.